Hello, I'm Dennis Wagner. I'm the Director of the Quality Improvement and Innovation Group.
And I'm Janine Wugo, Deputy Director for the Quality Improvement and Innovation Group.
The QIO program has, I think, a special space in American healthcare. CMS is deeply committed to the national goals of better care, better health, and smarter spending. And we believe that the quality improvement organizations and the QIO program are really at the center of delivering those results. And that means working with all provider types, but it also means working with others on quality improvement activities across the nation.
We also have across the board recruited over 7,500 nursing homes. So that alone is worthy of celebration. The report that you're going to view has a lot of information that reviews what's happened over the last year, and it has a lot of data that shows the success that we've achieved, and also several stories of teaming, collaboration among QIOs and their partners, hospital engagement networks, and other state-level stakeholders that are highlighting all of the important work that we're doing together. You're also going to see some highlights from this year's quality conference and a look ahead about what we're going to do in the upcoming year.
QIOs are really positioned to serve as an integrative force. Now, to serve as an integrative force, it's critically important that QIOs partner with regional extension centers, with hospital engagement networks, with the CMS Innovation Center models like the State Innovation Model, for example, and others. QIOs are doing that. We're excited about that, and we want to encourage even more of that as we go forward into the future. CMS Administrator Andy Slavitt announced the latest results on harm reduction at the recent quality conference here on December 1st. And what Administrator Slavitt had to share was truly impressive. 2.1 million fewer harms through the end of calendar year 2014 compared to our 2010 baseline, an estimated 87,000 lives saved, and 19.8 million in cost savings. These are impressive national results. We're seeing it in hospital patient safety, and we believe the QIO program is positioned to achieve those same kinds of results in nursing homes and in other provider-type organizations. The data is very exciting.
Yes, the recruitment data is awesome. We have exceeded targets in 6 out of 7 of our recruitment areas, specifically in care coordination, and then in nursing homes. I mean, geez, we set a target of 35%, and we've far exceeded that target, reaching 75%. The BFCC program has done some outstanding things. We've leaned our processes. We've become a much more efficient part of the QIO program, and we've also developed some really great tools for data transparency. Both providers and patients can now track the status of their reviews online in real time and get information at a much faster pace.
Quality improvement organizations in partnership with hospital engagement networks and supported by CMS actions with data transparency, incentives, penalties, payment policies have been able to generate major national reductions in harm.
So in the upcoming year, our focus is going to be even greater on data transparency and driving towards the aggressive targets and results that we know that we can achieve and that we've set out to achieve.
One of the newest accountabilities that we have here in the Center for Clinical Standards and Quality, and more broadly throughout the agency, is the implementation of the new macro. We're excited about that. The statute specifically calls out quality improvement organizations, regional extension centers, and regional health collaboratives to be those organizations that provide the technical assistance to the providers. And we were delighted as part of the quality conference to be able to say that those 3 entities will be eligible to receive the funding support along with others, and that this particular funding opportunity announcement or contract, when we put this contract on the street, we're going to encourage teaming among the eligible entities. So this role of convener of the QIO program, I think, is going to fit nicely with anticipated future work on the implementation of the merit-based incentive payment system. As we wrap up here today, we want to thank quality improvement organizations and the providers who are teamed with QIOs. We want to thank you for your hard work. We want to thank you for your results. And we want to thank you for the way that you work and team with others.
We also want to thank you for your focus on the patient and the beneficiary. your efforts to include them and to make sure that your processes are reflective of their needs and wants really is tremendous, and we really appreciate that work. We also want to thank you for viewing this report and encourage you to share it with your partners and with those other stakeholders that you're teaming with every day.
You bet. Great going. Thank you.